transparency at the open public hearing session of the Advisory Committee meeting. The FDA believes it is important to understand the context of an individual's presentation. For this reason, FDA encourages you, the open public hearing speaker, at the beginning of your written or oral statement to advise the committee of any financial relationships that you have with the sponsor, its product, and if known as direct competitors. For example, this financial information may include the sponsor's payment for your travel, lodging, or other expenses in connection with your attendance at the meeting. Likewise, FDA encourages you at the beginning of your statement to advise the committee if you do not have any such financial relationships. If you choose not to address this issue of financial relationships at the beginning of your statement, it will not preclude you from speaking. The FDA and this committee place great importance upon the open public hearing process. The insights and comments provided can help the agency and this committee with their consideration of the issues before them. That said, in many instances and for many topics, there will be a variety of opinions. One of our goals today is for this open public hearing to be conducted in a fair and open way where every participant is listened to carefully, treated with dignity, courtesy, and respect. Therefore, please speak only when recognized by the chair. Thank you for your cooperation.
How about dealing with Cindy?
Before I call speaker number one, I would like to inform those attending the meeting that we have offered the speakers to speak from various locations in the room to maintain recommended distances among speakers.
They have to separate all the CF patients.
Will speaker number one step up to the podium and introduce yourself? Please state your name and any organization you are representing for the record.
I was diagnosed with CF, specifically double delta 5-1, when I was nearly 8 months old, requiring 6 weeks of hospitalization in my first year of life. I was not hospitalized again with any CF complications until I turned 12. Since then, I've been hospitalized 7 times for IV antibiotic treatment. My lung function has now declined to 87%, and I'm expected to lose between 1 to 2% of my lung function each year due to pulmonary infections. I stand before you nearly perfect CF patient, complying to everything that has ever been asked. Swallowing 40 pills a day, doing 2 to 3 25-minute physical therapy sessions per day, and inhaling upwards of 6 medications through my nebulizer. Additionally, I play on an elite year-round soccer team in my high school varsity lacrosse and soccer teams. I was named Sports Illustrated's December Athlete of the Month, and I'm an honor roll student. I like to think I have the talent and aspiration to play in college. I also consider myself very mentally and physically tough. I have to be. CF battles with me every single day. I am blessed to be living in 2015 and in the United States, having access to the medicines that treat the symptoms and the infections that cause chaos on individuals with CF. These FDA-approved medicines and the treatment protocols of the CF care centers have increased life expectancy incrementally since my birth in 1999. However, planning for my future is more difficult than you may even imagine. For instance, by the time I graduate college, I'll be beyond my middle-aged years. This second part of my life will become very compromised, dealing with complications from advanced CF. Aside from the many physical challenges CF will bring, psychologically, socially, and economically, I will suffer. This is not an assumption, but a guarantee. There are thousands of individuals like me with CF that will travel down their unique pathways of this disease, but all roads will lead to the same dead end. Now, let's imagine me having access to Kalydeco and Lumicaftor this year, while my lung function is at 87%, but I am physically strong as I stand before you today. What might my future look like? I can tell you it looks bright. My lung function will stabilize or perhaps gain a few percentage points. Rather than being admitted for treatment for a lung infection, I'm out of soccer or lacrosse practice or scoring a winning goal for my team. I'm an active participant in life without the constant disappointment of CF slowing me down. My family and I are humbled by the science that has brought us here on its behalf. science that will stabilize the rate of decline and decrease yearly hospitalizations. Not losing 1 to 2% of my lung function each year is remarkable data. Decreasing the amount of hospitalizations each year will have a huge effect far beyond the obvious. CF is one of the worst genetic diseases mankind has ever seen. Without access to the drug combination for the CF double delta 508 population, the most common genotype, the decline will continue despite the medicines readily available. This committee holds the key to improving quality of life that our community has been working towards. And to not approve it for so many that have suffered not only be confusing, but cruel. On behalf of the thousands of children and adults with double delta 508 like myself, thank you so much.
Speaker number 2, please come to the podium and introduce yourself.
Absolutely. God, we're so proud.
So cool. This is going to be really sad. It's going to be someone who lost their